Hello everyone, welcome back, and today we are going to learn about Granuloma venereum. It is a synonym of Donovanosis, as we have already discussed in the first part. This is the third and the last part for the topic. In this part we are going to learn about the diagnosis and the management, mainly about the CDC guidelines of this disease. So, in diagnosis, the first and the most important is the microscopy. It is even more sensitive than biopsy. What we do here, we take a tissue part from the edge and crush them between the slides, or we can even take pap smear, and then we stain it with either Giemsa, Wright, Leishman, or any silver stain. Then we watch it under the microscope. What do we see? We see Donovan bodies in cells of Greenblatt, or we can also call it cells of Pund. So how does these cells look? These are large macrophages, or you can call it epithelioid cells, where the nucleus is pushed to one side by large vacuoles or space containing the capsulated bacteria of Klebsiella granulomatis, which has a characteristic safety pin appearance because of the condensation of the chromatin at the two poles of the bacteria. So let's mark it. This is the cell of Greenblatt. The Donovan bodies is either dark blue or black in color when stained. So this is the Donovan body. This is the nucleus pushed to one side. These are the two vacuoles. This is the vacuole. Let me write it down. Cells of Greenblatt are either macrophages or epithelioid cells. The Donovan body has safety pin appearance. The size is about 1 to 2 micron into 0.5 to 0.7 micron. This is the size of the Donovan bodies. This is how it looks. This is a large macrophage, and these are the various Donovan bodies. So here this is a pap smear. These are the two epithelioid or macrophages with the large vacuoles containing the safety pin appearing bacteria, the Donovan bodies. So there are some differentials of Donovan bodies, and what are they? These are chlamydial inclusions of LGV, amastigotes of Leishmania, the fish bacilli immaculate cells of rhinoscleroma, Michaelis Gutman body in Malakoplakia, and histoplasmosis. These are for differentials for histology or cytology, you can say. So in diagnosis, the next comes biopsy and histopathology. Here we can see a biopsy piece with the upper part is epidermis, the lower part is dermis. The center of the epidermis is filled with fibrin, and at the periphery the epidermis is thrown into folds or pseudohypoplasia. So this is the epidermis, this is the dermis. The pseudohypoplasia, the epidermis may contain neutrophilic microabscesses. So let us mark it down. This is the center of the epidermis, which is filled with fibrin, serosanguinous discharge, and this is the pseudo epitheliomatous hypoplasia. It may contain multiple neutrophilic microabscesses. Now The dermis, you will see the characteristic macrophage with the safety pin appearing bacteria. So the cells of green blood with the Donovan bodies. There will also be other inflammatory cells predominantly. So these are the inflammatory cells, predominantly histiocytes, and it will also contain plasma cells. Lymphocytes are less in number. The third is the culture. Culturing this bacteria is difficult in artificial media, so it needs yolk sac of chick embryo or human monocytes or hepatocells. Fourth is nucleic acid amplification test, which contains the PCR. The fifth one, recently there have been development in colorimetric test, colorimetric detection system for this bacteria. The antigen detection has not been described in this disease, while serology or the antibody is usually used for epidemiology, and tests like complement fixation and indirect immunofluorescence might be used. We'll move on to the treatment part. This is the screenshot from the CDC guidelines. In diagnosis, they have written difficult to culture and the dark staining Donovan bodies is a characteristic. In treatment, the recommended regimen is azithromycin 1 gram once weekly orally or 500 mg daily for 3 weeks or until all the lesions have subsided. The alternatives are doxycycline 100 mg BD, erythromycin 500 mg 4 times daily, or trimethoprim sulfamethoxazole double strength 160 mg 800 mg twice daily, and everything for 3 weeks, at least 3 weeks, or if the lesions take longer till the lesions heal, we need to give these drugs. So if there is no improvement with these drugs, we need to add another antibiotic, which is usually injection gentamicin 1 mg per kg IV 8 hourly. In all STI, we need to follow up. In Donovanosis, we need to follow up the patient until the signs and symptoms resolve. So management of sex partners, all the partners within the last 60 days should be treated with the same regimen. In pregnancy, they have written doxycycline might be associated with discoloration of teeth, and sulfonamides may lead to neonatal kernicterus with those with G6PD deficiency. So what is preferred? It is either azithromycin or erythromycin base. In HIV infected patients, the same regimen is followed, but we might need to give repeated dosing as it may take longer to heal. Now the next question is there any kit for Donovanosis in the kit system of the NACO or syndromic approach of the NACO guidelines? Here they have mentioned that these kits are for the most common causative agent of the any syndrome. So they have given kits for syphilis and chancroid, and they have given kits for herpes and LGV, but we can't find anything for Donovanosis. So Donovanosis is not very common at national level. In some parts of Orissa, Andhra Pradesh and Tamil Nadu, you may get few sporadic cases. Countries like Australia, China, West Indies and Africa have some endemic spots. So they haven't included it in the syndromic approach. But if they ask that which kit, if you want to give for this disease, which will be the kit? It will be the kit 7. Because this kit contains 42 capsules, that is doxycycline for which can be given for 3 weeks in BD dosing. So this will be the preferable kit if you want to give for Donovanosis. So this was the extra insight into the topic. With this, we come to the end of the class or lecture of Donovanosis. Thank you for watching. Stay tuned for lectures on other topics of dermatology. Do watch other lectures on the channel and subscribe if you like it. Thank you.